Hello, everybody. Thanks for joining us today. Sorry we're a little late. We were figuring out some of the interpretation settings. My name is Naja. I work at the CDPC and I organize these types of webinars. All right. So I'm joining all of you from Tiohtià:ke, Munyang, colonially known as Montreal, which is unceded territories of the Kanien'kehá:ka, of Kanesatake and Kahnawake. Um, and also, I want to shout out all the persons that are at Vandu today, having a co-watching session in person. That's really cool. Yeah, shout outs to all the participants who made it to this viewing party. I'm saying hi from about 5,000 kilometers away. Um, and yeah, so this project is very special, it's very precious. I'm really happy that we're able to talk about it at length today. It's the kind of project that is very important because uh, as we've noticed, the government doesn't really care about marginalized communities. The government is not really investing in our communities, being able to get together and have those types of conversation that we need to have today. And instead, it seems like the media is more interested in pitting different communities that are affected by the same policies against each other. Um, and when the government is not acting, when the government is not countering misinformation, and when the government is not pouring into the community organizations that are meeting the needs of our people, well, we have to take on that responsibility, take care of each other, and have these conversations. And that's why, in this context of the toxic poisoning drug crisis, in this context of the housing crisis as well, um, I think this kind of initiatives where we have people who are from Chinese speaking communities, people who are from other immigrant or language minority communities are able to actually talk about the reality and what's affecting them in ways that are constructive, in ways that are building solidarity, and in ways that are breaking the stigmas that is affecting our communities. You know, um, I think us being able to take that power back and host these kinds of conversation is not only good for the people right now who are currently struggling with housing, with the effects of the toxic drug crisis, uh, racism. Um, we're able to build compassion with one another as neighbors, um, as people who are marginalized. And this is not just a good lesson for our generation, this is a lesson also for the younger generation that are going to be able to grow up and not judge the people that are suffering on the street, not judge the people that are using drugs to cope with their conditions, and this can also just have a positive effect on uh, just as marginalized communities being in solidarity with each other, understanding each other, um, and not marginalize the ones of us, in those communities that are going to be using drugs, that are going to be struggling. And so building that understanding um, is super important. I'm very, very honored to be introducing the work that Yarrow and Vandu and my colleague Nicole have been doing. Okay, I'm not gonna speak too much anymore. But yeah, it's really special. I invite you if you are in Vancouver, outside of Vancouver, in any other provinces, and you work with immigrant communities, if you work with language minority communities who face similar experiences as the one we'll talk about today, feel free to leave your contact in the chat. Feel free to connect with us after that. This is work that I think is important that we see happen across the country. And so, without further ado, for you to understand what work I'm talking about, I'm gonna give the microphone to Liana, our moderator for today, and I'll see you all at the end. Thank you.
Hi, everybody. I hope you can hear me well. My name is Leanna Wong. I use she, her pronouns. And today I'm calling in from the unceded traditional Coast Salish lands, including the Tsleil-Waututh, Coquitlam, Squamish, and Musqueam nations, also home of the North Fraser Métis Association here in Burnaby, BC. Um, yeah, it feels very full circle to be able to help facilitate this webinar today. I have worked with Yarrow in a volunteer capacity, and I remember during my MPH program, my public health interests included harm reduction and mental health. And so the first time I had heard of the Canadian Drug Policy Coalition was when I was studying for my MPH, and I had come across one of their articles about Imagine Safe Supply. And I just loved the article so much. I thought I learned so many things in a it used very simple language. So I was able to understand the content. Um, and flash forward, I think it was 6 months later that Bev from Yarrow had said, "Hey, I know you're studying your master's right now. I know this is something up your alley. Would you like to work together with the Canadian Drug Policy Coalition um, to maybe do a research project together?" So that's how I got introduced into the work. And I reflect on it quite often. And I think it's funny how things turned out. But a little bit about me besides that is I was born and raised in northern BC. I grew up in the downtown core of my city. And in the downtown core, it was home to lots of complex social issues such as drug use, crime, poverty, lots of mental health issues. And I think through my just lived experience of witnessing that, as well as being a frontline healthcare worker, where I witnessed a lot of Indigenous specific racism, it made me realize that my interest is not so much um, at the downstream level of healthcare, but it's more so the upstream. I want to know why things are happening and what policies can we create to help ensure just improving health access and equity for everybody. So, yeah, I've completed my MPH and now I'm a health promotion specialist at Métis Nation, BC, and I'm so grateful to be part of this work. I'll pass it over to Bev.
Hi, everyone. I'm Bev from Yarrow Society. We're based in Vancouver, Chinatown, on the stolen, unceded, traditional, and current territories of the Coast Salish peoples, namely the Musqueam, Squamish, and Tsleil-Waututh nations. I've been in a staff role there as the operations manager since spring 2021, so just 5 years now. And yeah, we offer free services for low income Chinese seniors who live in this neighborhood. So Chinatown, Strathcona, the downtown east side, more or less the V6A postal code. And yeah, that includes housing, health, income, food services, recreational, arts, cultural, and educational programming too, just dependent on our own capacity and funding as a small nonprofit. Yeah, and I grew up in the city, and I grew up mostly in the Chinatown area with my two grandmas who both lived here and raised me. So I feel very lucky and grateful as like a non-Black and non-Indigenous settler to have been able to grow up on these beautiful lands and to know and learn a lot of my culture. And to also have like grown up around drug use, around like gang activity, and uh, yeah, just to a lot of experiences that I feel like really helped me with my work and my life today. So yeah, I'm also very grateful for Leanna, Nicole, all the folks at the CDPC, who have helped support this project and brought in a wealth of experience, and have really believed in Yarrow and believed in um, the project and making it possible, adapting to it. And yeah, of course, all the wonderful seniors who came in and who were very eager to hear from myself and Nicole and are eager for more programming like this. So I think sometimes we have preconceived notions of elders or older generations being more conservative, and that is true sometimes. Um, but yeah, I think we really just need the space and time to have these conversations with each other, and to present the information in a digestible and accessible way. So yeah, I think the project um, is a start for something very very promising and very exciting. So I'm glad there's folks joining from all over today, and it'll be great to hear from everyone.
I guess I'll introduce myself. Can everyone hear me? I'm okay, perfect. Yeah, hi, my name is Nicole Luongo. I use she, her pronouns. I am originally from what is colonially known as Vancouver. Since 2024, I've been in Toronto. But definitely, yeah, all of my formative experiences were in Vancouver. I am the systems change analyst with the Canadian Drug Policy Coalition. Um, what that means depends on the day. This project is actually quite a bit outside of the scope of my normal work, which is partly why it's been so exciting. I spent many years myself as a criminalized drug user on Vancouver's downtown east side. Was homeless in the neighborhood for quite a few years and never really left it, emotionally or literally, until more recently. Um, following kind of that period of my life, I went and got an academic background in medical sociology, where my research kind of looked at how turning drug use and other kind of unusual or deviant behaviors into medical problems can often function very similarly to policing and prisons. So a lot of my thinking and writing and work at CDBC pertains to substance use treatment, and really how the treatment landscape kind of replicates the unregulated drug supply in a lot of ways, and can be very, very harmful. Other than that, I do some local harm reduction organizing here now. And yeah, I think I'll just leave it at that for now.
Thank you, Nicole. I think that's my cue to get started then. So, we have a few questions lined up for folks today, and I'm excited to dive in. So, I'll start with the first question. This is a two-part question. Why was the project initiated, and what need did it meet? A, what are some of the background and contextual factors that motivated CDPC to engage with Chinese language groups in Vancouver? And why did the Canadian Drug Policy Coalition choose to partner with Yarrow?
Yeah. In terms of just the practical details, in 2024, we saw that there was an opportunity to apply for a Michael Smith Health Research BC REACH grant, which is a very modest grant that kind of focuses on knowledge translation. So we weren't trying to produce original research. Rather, we wanted to take the findings of completed research and make them more accessible to communities. And so when thinking about, kind of what we wanted to focus on, again, I was based in Vancouver at the time, and that was, the period where pushback to not just harm reduction, but the decriminalization pilot safe supply had like really reached a fever pitch, and we knew that there was just kind of mis and disinformation about all of those policy areas like flowing really rampantly. We are already having, some conversations about how non-English speaking populations were being excluded in drug policy conversations and debates. And I can say personally, like I have learned and continue to learn a lot from groups like the South Asian Advocacy Network for Justice and Harm Reduction, which is a committee within the Surrey Union of Drug Users, again, about the extent to which like non-English speaking populations are being excluded. This was right on the heels of a very kind of public controversy over what was a proposed safe consumption site in Richmond Hospital. And I think that event like really, again, illuminated how Chinese speaking populations specifically were not being consulted or engaged. And so we know that kind of a lack of access to evidence-based information is a barrier to drug policy reform. It is by far not the only barrier, but it is a factor. And there's also just the moral or ethical issue of recognizing that excluding immigrant populations, non-English speaking populations, racialized populations, from these conversations is really just replicating like historic and current injustices. And so Leanna's already kind of mentioned that we had connected. And so all of these pieces just kind of came together. And the idea for the project was born. I can say I already knew Bev and knew that Yarrow had a really cool and long history of like showing up for drug users and drug policy advocacy. And so it just seemed like a really natural fit to reach out.
Thank you, Nicole. Let's move on to the second question then. Would you be able to describe the project methodology, timeline, and task delegation, please?
For sure, yeah. And I guess I'll also just say we are getting ready to release, it will be released today or very soon, kind of the final report from this project. It's very long. It's far too long. But everything that all of us are going to say today, I think, we'll just kind of gloss over a bunch of stuff. So if you want more details, please feel free to see that on our website. But yeah, in terms of the project like timeline and things like that, initially we were going to focus on research as an entry point around the area of just not just around the area of harm reduction and safe consumption sites specifically, looking at kind of the health benefits of safe consumption sites as a way to initiate some conversations. We pretty quickly realized that focusing solely on safe consumption sites was too narrow. And kind of zooming out, a lot of the public complaints or issues with safe consumption sites often revolve around the idea that they like attract crime and social disorder and public drug use. And we know from a comms and messaging perspective that countering that narrative only with like research on safe consumption sites alone is not always the most impactful. Like I can talk forever about how safe consumption sites, reduce infectious disease transmission, prevent overdose fatalities, but we also know that people base their opinions on emotions. And so to have, I think, more effective conversations about drug policy, we actually need to look kind of more upstream and address directly why people feel unsafe. And that requires discussing issues of poverty and homelessness and other forms of marginalization, as well as the unregulated drug supply itself. I always kind of say it's preferable to prevent overdoses than reverse them. And to do that, we need to talk about drug prohibition. And so we kind of used research on safe consumption sites as kind of that beginning point, but it ballooned pretty quickly. We also anticipated that framing the project as being about community health and safety would probably attract more interest because it spoke directly to like Yarrow service users' daily lives. And so the initial plan was to host two in-person engagement sessions in 2025. But after connecting with our wonderful translators, we realized that that was going to get too complicated or not be adequate because we were reaching out to people who spoke Cantonese and Mandarin. So trying to do all of that in one session wasn't going to be feasible. So we ended up dividing the group of participants into two, one for each language, and hosting four sessions total. In terms of a bit of a timeline, we initially put out a recruitment flyer. After getting a fair bit of interest, we released a baseline survey just to assess, participants' kind of attitudes and beliefs. It consisted of, getting a getting to know you section, asking some demographic information, as well as some questions about people's views on their own health and safety, community health and safety, their familiarness with drug use, um, their beliefs and attitudes about it. And then Leanna analyzed all of the responses, and we used that to form the basis of our first engagement session. And the goal of that first session was really to foster rapport more than anything, to get an understanding of what folks liked and disliked about living in their community, and to do some of that kind of baseline knowledge building with the goal of then transitioning to drug policy specific topics a bit later on. After the first session, we distributed another survey and analyzed it, as well as some take-home kind of information resources based on what we discussed. And then session two, we built on that. So after a bit of a review, we did talk about drug policy, and we had already established that participants, had a lot in common with residents of the downtown east side in terms of shared experiences of government neglect, displacement, socioeconomic and political marginalization. There were a lot of the same issues that were being faced by each community, ranging from, lack of access to public transport, to bathroom usage, to broadly just feeling excluded. And so we use that as a foundation to talk about how drug policy kind of intersected with that and how folks might be contending with those issues by consuming substances. And so following that, we distributed yet another survey, analyzed some of the results, and we will talk about that in much more detail for the rest of this session. And yeah, we kind of knew going in that we wanted to kind of use this as a bit of a like use case for developing a methodology that we could replicate elsewhere. So this was a very small scale project. But the goal and purpose was partly not just to engage with the participants as it happened, but also to consider like what some of the lessons we learned were and what might be generalizable and then taken up by other groups and other communities. Yeah, that was a lot of talking for me, so I'll stop there.
Thanks, Nicole. I know clearly we really loved our surveys, but like you said, they were so helpful for forming the basis of the next session. Um, Next question I wanted to ask you was, what are the key findings from the project as they relate to A, general group dynamics, B, effective process-based decisions, C, effective communication strategies, and D, unanticipated or surprising outcomes?
Yeah. There's a lot there. Bev, do you want to just kind of like give folks maybe a summary of like how participants knew you already? Because I think that was like probably the key thing to all of this project.
Yeah, I could talk about that. Um, I guess the group dynamics. I just put out like an open call to um the seniors, the clients that we serve at Yarrow to see who was interested and available to attend the session. So I think we had about a dozen seniors in total. Um, that we collected surveys from and who also came to um, both sessions. Most of them actually attended both and were quite eager after the first session too. And many of the seniors I've known for a few years from working in the neighborhood at Yarrow or elsewhere, and a couple others I didn't know as well, but I think they trusted my other colleagues, like our other program staff, um, and just had an interest in. I think some of them have a specific interest in drug use or drug policy, and then others are just generally interested in educational opportunities or free programming that's in the community, um, just so they can get out of the house and stay active. Um, but yeah, I thought the group dynamics were generally pretty good. There were some folks who were a bit more outspoken, and others that we tried to um, encourage to speak out or that we talked to more during the breaks. So actually during the like lunch and break times, we had a lot of fruitful conversations with the seniors. I think it was just more casual and we had more time. Um, yeah, just to hear what they were thinking about or things they had seen in the news. Or some folks were reflecting on how um, they like drug use has affected them or things they've seen and um, in media or in WeChat and WhatsApp groups. So yeah, I think that was really interesting and insightful for us. And yeah, we were really lucky that the seniors really trusted us and as a result, really trusted Nicole and looked up to her as sort of a subject matter expert. So even though some of them disagreed with what she shared, with what Nicole shared about safe consumption sites or the efficacy of safe supply, they were still, I feel like, very open to listening to her and considering it. So, um, yeah, and I think because we didn't come from, we tried to not come from a place of knowing more or trying to convert or convince people of anything, then maybe folks felt more comfortable and um, sort of on the same level or respected and like they could also share what they thought. And and then of course some seniors felt, I think, more empathy or um, yeah, when Nicole shared her personal experience with illicit or criminalized drug use. Um, yeah, and her educational background as well. Um, yeah. Is there anything else, Nicole?
Yeah, I'll say that, I showed up and there were some very obvious like power differences in the room, right? I was the only white person there. I'm also, I showed up in my official capacity, right? So as someone, who has a formal education and credentials, and I tried to be really cognizant of that because I did not want to be someone who just came and, was there to tell folks why their beliefs were wrong and to just have this like one directional kind of not exchange of information. So I tried to be really mindful of that. But it was really obvious right away that, yeah, the trust that folks already had in Bev and Yarrow was the most important factor. At the beginning, I did what most of us would do in this type of setting, where I went through some community agreements, discussing, things that would hopefully make all of us feel more comfortable or safe. And then, going through this whole kind of rigmarole, I turned it over to participants and asked them, what would make you feel more safe today? And I just got these kind of blank stares. And then, one participant was kind of like, well, we are safe. Like we're at Yarrow, we're with Bev, and Bev invited you. So obviously we're safe. And then it kind of dawned on me like, okay, like that's really important. And the participants had also established a comfortable rapport with each other. As Bev says, many of them engage in a whole bunch of programming. And so to an extent, like pre-existing dynamics were definitely, I think, reproduced or replicated in the room. Some folks were a lot more comfortable being much more vocal. Others were probably more comfortable just being a bit quieter or deferential. And so that became really interesting when we had people with really strong opinions or policy champions in the room. And there were a few folks who really stood out as being very eager to advocate for progressive drug policy reform. And we also had some folks who were also very comfortable kind of resisting it. And so watching those dynamics unfold was really interesting. And I guess some of the lessons there was just we had to amend our approach a little bit for the second session, just by reminding everyone that everyone was invited to speak, get a little more proactive with facilitation, things like that. And then yeah, in terms of some other things, Bev, you already mentioned that like we had discussed at length about whether it would be appropriate for me to do any personal disclosure about my own history. And some of the benefits of doing something like that can be that it disarms people. At the same time, my story is unique to me. And there are many people who have extensive experience of criminalized drug use and homelessness who do not pursue abstinence, who do not ever engage with the formal education system, things like that, just whose lives don't look like mine. And that's fine. And so when I do personally disclose things, there's always that risk that folks will assume that everyone's life can and should look like mine. And so ultimately, like I did tell folks a little bit about myself, but just reminded everyone that we weren't there to talk about me. And yeah, my personal story was just that. But I think it did, yeah, have that disarming effect a little bit. And when folks expressed, a lot of understandable like fear and anger at times about seeing drug use, I think having someone in the room who could identify as a person with lived experience was helpful in that way. Another things about kind of just general group dynamics, and again, I'll say in the report that is too long, things have been separated into, general group dynamics, setting specific dynamics, things like that. But for the purposes of today, I'll just kind of lump them all together. I'll say that I think the participants in this specific project and location, like their perspectives, I think were just at least partly informed by their exposure to such extreme visible poverty and marginalization and drug use. The downtown east side in Vancouver is quite unique in its own right. And so I think the intensity of some people's beliefs were probably strongly informed by just the routine daily kind of immersement in yeah, an area or neighborhood that is home to such visible suffering. Another kind of few things on that topic I'll say is that something that we were made aware of is that it was actually very difficult to actually offer clear definitions of what we meant by the downtown east side and Chinatown. Obviously the boundaries of those neighborhoods are very porous, both geographically and kind of culturally and politically. So after the first session, we got the feedback that people weren't entirely clear on what we meant when we use those terms. And then it became obvious to us that neither were we really. And so at the beginning of the second session, we had a chat about that and kind of recognized that a lot of how those definitions are formed are rooted in stereotypes. And so in offering definitions, we kind of defaulted to those stereotypes to problematize them and became this process of collectively arriving at, yeah, these definitions of, okay, when I hear downtown east side, I have all of these primarily negative stereotypes associated with it. Whereas when I hear Chinatown, this is what I think. And so it provided an entry point to have the conversation around like, A, there are people who use drugs in Chinatown. And beyond that, again, just to discuss so many of the commonalities that folks who inhabit both neighborhoods or both spaces experience vis-a-vis like government policies. and the shared needs. And so that was really a good opportunity to like build some solidarity just in trying to come up with the definition. Yeah, I think this question, Leanna, do you want me to talk about like process-based decisions and things like that, or was that just for the first part?
If you could speak to effective process-based decisions, and maybe I know you touched on it briefly, effective communication strategies, I know that would be great just because I know like a big part of this project was taking such a complex idea and putting it into simple terms for people who didn't have much understanding to be able to slowly grasp that concept.
For sure, yeah. So Bev and I co-facilitated. Um, we decided that it made sense for Bev to ask participants questions pertaining to their daily lives that they knew Bev would also be intimately familiar with. So, Bev, do you want to just talk a little bit about, yeah, kind of what you asked participants to lay that groundwork?
I I recall we asked some basic questions about I think it was how how folks feel about living in Chinatown, what they liked and disliked, or um, where they places they frequent, or sort of their support networks. I think that was an important one that helped set the basis for the discussion about um, drug use or certain types of drug use. Um, yeah, and so a lot of folks, like Nicole said, brought up um, like systemic issues that seniors and a lot of downtown East Side or Chinatown residents face, um, whether it's housing, the lack of public bathrooms, like struggling to get by on a fixed income, um, and then safety issues that they have in the neighborhood. Um, yeah, so I think it was good to hear that. And a lot of seniors also shared that their support networks included each other, family and chosen family, Yarrow and other community groups or drop-in centers that they frequent for services or for social connection. And I think it was a strong segue for Nicole to introduce protective factors and yeah, sort of the reasons that some people may um, be using drugs and that a lot of issues that could be resolved um, through housing and through public housing, through public bathrooms and more services for everyone that everyone needs. Um, so yeah, I think we spent a lot of time trying to emphasize that and trying to emphasize again, like Nicole mentioned, the commonalities and that how poverty, redlining, um, racism is are things that many residents face in our neighborhood.
Yeah, I think it was really useful to have both of us kind of alternating. So as Bev said, I think you, Bev, did the bulk of the facilitation in the first sessions because there was so much groundwork to lay. And then I kind of tagged in when it came to more like subject matter, drug policy specific things. So after laying all that groundwork, I kind of discussed the distinction between legal and illegal drugs. And Bev used the term protective factors. So we use that to get participants to kind of consider what led to them having like good health and social outcomes, whether that be strong network ties, access to programs and services like Yarrow, stable housing, healthcare, things like that. And then we kind of highlighted that many folks who use drugs on the downtown east side don't have access to those protective factors. And drug use can actually be a very reasonable response to that. And so we, yeah, spent quite a bit of time on that. That kind of was the bulk of the first session. And then by session two, folks were, I think, kind of more prepared to delve into more drug policy specific topics. So we presented, harm reduction and safe consumption sites specifically as kind of an antidote to that type of marginalization. Spent a long time discussing, what they can offer folks in terms of community care, a sense of belonging, access to services at times or referrals. But again, as I said earlier, we didn't want to position safe consumption sites alone as like a utopian solution to all of the social problems that participants experience because they're not. And so that gave us kind of the ability to talk again more upstream about why drugs are prohibited in the first place and what kind of robust government investment in things like poverty reduction and housing, as well as ultimately legal regulation, could provide, not just to people who use drugs, but everyone. And so, in terms of framing and communication, we really focused on emphasizing health and safety because participants identified that for themselves as being critically important. And so, we spent a fair bit of time in the second session actually talking about legal regulation itself. There was kind of this logical sequence that led us to that point. And participants were prepared to kind of consider how having a legally regulated drug supply in tandem with all of these other things that, were required could actually make their own lives easier as well, and allow them to feel more safe in their communities. A lot of participants expressed a lot of distress at seeing visible overdoses. There was a lot of pantomiming, I guess you could say, because people were using different language. There was a lot of kind of acting out, I see this and, emulating kind of people on the nod and overdoses. And so I kind of adopted that too. Yeah, I was a lot more charismatic than usual, probably, because I'm not. But yeah, talking about like how a legally regulated drug supply could mitigate some of what folks just saw out on the street that was causing them to feel afraid, to feel angry. On that note, I'll say, yeah, in terms of framing, it was really interesting. Like normally when I engage with folks about drug policy, any part of drug policy, people tend to fall into one of two camps. You have folks who treat drug users as criminals. So there's that like crime narrative. And then depending on who I'm engaging with, you have kind of folks who fall into the camp of treating drug users as sick people. Both are problematic. Um, and we try and, counter both by reiterating that drug use can actually just be a neutral activity and it doesn't have to be pathological. That being said, participants here like didn't really have any issue merging those framings in ways that were quite unusual. So we would get, folks talking about how they see people with visible wounds on the nod, and like how much distress it caused them and how much pity they felt and how sad it made them. But then in the same breath conclude with, you know, and they need to be criminalized, basically. So it was a bit of a roller coaster that way, especially because it was all done through translation. And so I kind of found myself a lot of the time like waiting with bated breath because I wasn't always sure where things were going. So it was like pretty cognitively demanding that way, but also like really stimulating and interesting. I will say something that was really important that stood out was just the efficacy of like repetition and really simple language. So early on, I started saying, when explaining why folks were seeing overdoses and things like that, just people don't know the ingredients of their drugs. And that word ingredient seemed really effective and seemed to resonate with people. They could kind of not totally agree, but many people agreed that people should know the ingredients of what they're consuming. So I just started repeating that over and over and over. Similarly, just using terms around health and safety over and over. And that really simplified things and made it easier to communicate. Something that I really want to point out that has like really significant implications for a lot of things was that we got a message shortly before the first session from one of the translators going, so small issue, there's no direct translation of the word drug in Chinese. So, when I talk about drugs and people generally know what I'm saying. Um, But yeah, there is no direct translation of the word drug. Bev, do you want to like maybe elaborate on that a bit? Because it became really important.
Sounds good. And then maybe Karina can jump in if they're here. She offered some insight too, and JD. I know JD's interpreting. But yeah, I think and something we also had like ran into at Yarrow or just in like the Chinese community in general is that usually when we talk about drugs, like you'll either call it medicine or you'll call it like poison, basically. And so um, some more like progressive groups or writers have come up with terms that are, I guess, more neutral, like somebody who uses substances or somebody who uses medicine. But because those terms are not like commonly used, then most most like Chinese speaking folks would not understand what that means. So yeah, I think there's some difficulty there. And then um, some of the terms for to describe drug users were like more derogatory and sort of just in common use. I guess similar to English, like people might say junkies or addicts or yeah, other similar terms to um, yeah, which kind of indicate as well like their views of drug use. Um, so yeah, I think that was kind of difficult to navigate, and it was really helpful that our interpreter JD did very extensive research and tried to read a lot of like local Chinese news coverage um, and look online as well, just to make sure that the the language was accurate and um, also like understandable and accessible for seniors. So yeah, I think we did have to spend quite a bit of time before the session and during the sessions as well. Um, and then of course there are different viewpoints. And so some participants maybe disagreed that like using illicit drugs would be considered like medicinal or helpful for that person. Um, so yeah, I think it it was a good learning experience for us as facilitators as well as for the participants. So um, yeah, I think for me it just really highlights that um, yeah, we need to be putting out our own like materials and our own media to be countering like more conservative, I guess, minority language media. And yeah, again, a lot of it is just that there's not a lot of, um, yeah, opposing like opinions being put out there. Um, so yeah, and I see that Kelly put a really helpful comment in the chat too.
Thank you, Bev and Nicole. Sorry, Nicole, I saw you unmuted. Did you want to add more to that? Okay. Um, we're getting near to the end. I also wanted to ask how many of the project findings do you think are generalizable to Chinese language groups in other Canadian jurisdictions?
You want to start, Bev? I can go.
Yeah. Well, I'm not sure because I haven't interacted with too many other Chinese communities like this deeply outside of Vancouver, Chinatown, other than I guess my own family or just other Chinese folks around the city. But just from seeing a lot of the rhetoric and discussion online, seeing what's happening in Burnaby and Richmond, a lot of backlash from Chinese speaking communities for supportive housing and for safe consumption sites. I think that a lot of the uh, research or findings that we sort of synthesized from the project could definitely be helpful for other Chinese language groups across the country. But again, like Nicole had said, um, I feel like there was also specificity to our project that we only surveyed and had discussions with Chinese seniors from the downtown east side. Um, so yeah, that is a very specific political and like cultural context. Um, and I mean, there are Chinese folks outside of the neighborhood who um, look down on the downtown east side or have certain um, misconceptions about the neighborhood, just like a lot of Anglophone or English speaking communities. Um, so yeah, I guess in general, I feel um, like the conversation questions, the presentations, and how we sort of presented the information could be helpful. And I guess the findings would be insightful or interesting for people who are interested in drug policy or engaging with non-English speaking communities. But of course, not everything will translate, and then I myself am ignorant again to not just like Chinese speaking communities in other parts of the country, but I feel like the rural or small town context is quite different. Um, and so yeah, I'm not sure how much would be applicable there, although there is growing like immigrant populations in smaller towns now.
Yeah, I'll just add to that. Like we've tried, at least in this report, to kind of distinguish between what was very setting specific, probably, and population specific to Vancouver, what might be generalizable in terms of working with Chinese speaking populations elsewhere, and what might be generalizable to just working with non-English speaking populations. So there's like layers of applicability possibly. One thing I think is important to mention is that a lot of participants like pretty routinely cited the Opium Wars and the history therein. We did bring it up at the outset. In hindsight, I think we could have and should have dedicated even more time to it, and I wish we had. But both during the formal discussions and during breaks, as Bev said earlier, like that was a really persistent thread. And a lot of participants framed their responses and their attitudes and beliefs kind of around that history. And it was for some this taken for granted assumption that their belief was informed by the fact that to them, kind of resisting drug use, promoting abstinence was actually seen as part of an anti-colonial struggle. So there was a paradox there because, from my vantage point, from the people I work with in my organization, we see drug prohibition as being colonial in a Canadian context and globally. And it functions as a tool of imperialism. Whereas participants kind of were expressing the inverse. For them, abstinence was part of this broader anti-colonial struggle. And so that I don't think is going to be unique to a Vancouver setting. It might manifest with some specificity there, but I think that's probably going to be found elsewhere. And then even more generally, just things around like process-based decisions, I think would apply in most settings, i.e., good hospitality is good. Feeding participants was appreciated, ensuring that the timing of sessions was appropriate for them, paying heed to access needs, whether that be printing things in large font due to some people's limited eyesight, making sure everyone had support if they needed to go to the bathroom, like some pretty fundamental stuff that I think you could probably generalize. And that was just really important for building rapport. Yeah.
Thank you, Nicole. How many of the project findings do you think are generalizable to other non-English speaking populations?
kind of started, I sort of answered that. Yeah, the ones about good hospitality, certainly. And I think just like showing up with an ethos of care. And like I said earlier, not showing up with an attitude of I'm going to bequeath or bestow like the proper information upon you. And, I wasn't there to try and convert anyone. Was really there to just like see where folks were coming from. And so I think in any setting that is really important and practicing humility in that way. No one likes being told that they're wrong and that an expert's going to correct them. Like that's just not a good thing to feel. So I suspect that would be the case in most places. Yeah, just showing up with yeah, recognizing that there's a lot I don't know. And I was, I think, equally curious to learn from participants because they had so much to teach me. Yeah, I'm really appreciative of them. They yeah, they taught me a lot and were very generous. So yeah.
Absolutely. I think we tried our best to make it a mutual learning experience. So everyone was learning together, really. Thank you for sharing both Bev and Nicole. I will pass it back to Naja, who will facilitate some questions, I believe.
Oops. Can everybody hear me? Okay. Yeah, so we've received one question thus far, but I invite you to, go as long as you want, or if there's anything that you forget to, to include in the conversation. Otherwise, people can still leave comments or questions, and we'll get to them right now. The first question we have is from Leah, who I believe unfortunately had to leave. And the question is, do you ever encourage people to engage in municipal politics, voting, speaking to city council, in support of safe supply and other related issues?
Bev, I'm assuming that question might be for you in terms of supporting folks at Yarrow.
Yeah, I don't think at Yarrow we've officially told seniors to speak to council or vote for any um, like pro safe supply or harm reduction policies. Um, we just do that on a more general sense. So um, sometimes when there's an election coming up, we just try to provide information um, to seniors or to our clients on how they can register to vote, where they can go or where they can find information. Um, yeah, so sometimes my colleagues will have um, what we call like a seniors core meeting where they just sort of provide general information on that. Um, and then we just try to keep seniors updated on things happening in the neighborhood, um, whether it's different policies or benefits, community events from Yarrow and other groups. Um, and so we just make announcements to seniors in like our online groups or in-person events, and then seniors are welcome to decide whether they want to engage or not.
It feels like a lot of folks might want to. I will say I was surprised by how eager participants were to criticize the government, frankly. That was a really persistent thread. Um, yeah, and was frankly quite helpful to have that as a base attitude. Yeah. I guess I'll just say, I mean, I hope this is related, like from our perspective. Um, yeah, returning to this idea of translation and there being no direct translation for drug. Um, JD, the translator, and Bev, you both put together like a bunch of really helpful documentation about what was consulted in terms of trying to come up with a consistent translation, often government documents at the provincial level, as well as different levels of government, as well as health authorities. Yeah, and we recognize that there was no consistent translation, and at times there was definitely some very incorrect translation, i.e., we're going to try this 3-year decriminalization policy, but we're decriminalizing poison. And so, this is a bit tangential, but yeah, for us, that's been helpful in terms of recognizing that governments should have that information. And again, that information alone is not going to change government decisions, but when you have different levels of government experimenting with policies, to use their language, that we want to support, they need to be communicating it to the entirety of the public and communicating it accurately. So that's provided us with just some things to think about, and some recommendations to make therein. Yeah.
Leanna, I'm wondering if you have anything to add. Otherwise, we got some really interesting follow-up questions.
I don't have anything to add. I think we should dive into the follow-up questions.
Awesome. So I'm looking at two really interesting questions. We have plenty of time. So I'll get into the first one, and I think it's kind of related to this thread of people critiquing the government. And this person is asking if we can elaborate a little bit about how abstinence was seen as non-colonial.
Yeah, I could talk about it a little bit from my limited understanding. I think, yeah, growing up and hearing about the opium wars from family, it's kind of like a big, um, I think is really shameful for a lot of Chinese people, seen as like a very weak time in our history, when there were a lot of colonial powers. Um, yeah, cutting up China into partitions and such. And so the way some of my family members talk about it, and I've also heard similar sentiments from the seniors that we work with, is that, oh, if we hadn't if Chinese people hadn't like traded opium or started smoking opium, then we wouldn't have lost like so much of China to colonial powers, or that's what weakened us. And so I think from that there's a lot of anti-drug use sentiment, um, or just that like you weaken or compromise yourself if you like use drugs or sort of, yeah, alter your body or your mind in that way, or you're just seen as weaker. Yeah, that's sort of my limited understanding of it. So yeah, like Nicole said, there was a lot of it was brought up a lot, the opium wars, and I guess they see some Chinese people see opium as used as a weapon for war or for um, colonization. Um, yeah, so they kind of um, like that forms some people's beliefs, and um, I think that's how they view some drug users here, as like, oh, you just didn't have the willpower to to stop using drugs, or not start in the first place. Um, and then there's sort of a maybe feelings of sympathy. Um, yeah, although that's also problematic as well in some ways. Um, yeah, so I'm not sure if that answers your question about abstinence.
Um, I think that was a great explanation, and I have a follow-up on that, which is obviously like when you're explaining that historical perspective, that reaction is understandable, and I've heard those sentiments shared in certain organizing or direct action spaces where people are honing in on, like, being present and not being on drugs and having those be sober spaces. But our work basically um looks at how Canadian drug policy acts as a tool of colonization, population control. And so during the dialogue, when that point about abstinence was brought up, was that perspective of the history of Canadian drug policy, was that helping people bring nuance into their understanding, or learn new things?
I can say that I'm also seeing the comments here. So yeah, the 1908 Opium Act in Canada like was referenced. Again, in hindsight, I regret that we didn't spend more time on it. I think an entire session on that history would have been valuable. But talking about this idea of the participants recognizing that they experienced government neglect, trying to go from there's this history of the opium wars, which is instilled in participants like anti-drug sentiment that they're bringing with them, to Canadian contexts, the 1907 race riots in Vancouver, or anti-Asiatic riots, I should say, and then the Opium Act, um, framing that as that is actually like some of the origins of the government neglect you're experiencing today, like trying to invert some of that. I'm not explaining it well because we didn't plan it. I didn't plan it, I should say, out well enough because I didn't fully anticipate how much of that would be present in the room. I think we had discussed in advance, like how much time should we dedicate to that, and kind of said that that will get very complicated and it's an important complexity, but we kind of wondered if we would be able to discuss anything else. And so, yeah, in hindsight, would have done some things differently. And that's definitely in our like lessons learned section of the report.
Yeah, I think it was difficult to try and narrow down what we wanted to or could like feasibly have time to talk about in the limited number of sessions that we had. And I remember I did speak with Nicole and Leanna about this. But yeah, I think it would have been helpful to talk about the history of Canadian drug prohibition. Um, yeah, and how it is part of Canada's colonial history, especially in trying to control Indigenous peoples, um, even to this day. So yeah, I think um, in future iterations of this, I would like to see that included and have more focus on how it impacts Indigenous peoples here. Um, yeah, because for a lot of the conversations or meetings that we've had, or yeah, that we've had with Chinese seniors about residential schools or um, redlining or the specific kind of racism that Indigenous people here face. Um, yeah, there is a lot of empathy and sometimes shock as well too, because maybe they previously didn't know about that. Um, so yeah, I think that would help offer more context. Um, yeah, but it is very difficult because we include that and we include history about the opium wars. Um, it is getting to a lot. There's a lot of geopolitical context. um, yeah, across the Pacific.
I think perhaps maybe another reason why we decided not to include that was, again, because of the limited time we were able to spend with participants, but just recognizing that the purpose of our project was not so much to focus um, on that as opposed to trying to promote health and safety within the Chinatown community.
Yeah, it was tricky because we kind of went, what is the longest session we could reasonably have how many can we do? And that was 3 hours per session, 2 sessions, and then recognizing that everything was done through translation. And we wanted to give folks a lot of space to talk. So trying to keep the commentary or the content and then questions quite limited. Yeah, we were working with pretty significant constraints and definitely like made the best choices we could in advance, and then in hindsight recognize there are things we could have done differently as well.
Thank you for expanding on that question. I kind of have a mix of a question slash addressing some things in the chat. People are mentioning here an opportunity for intercommunity solidarity. Um, and I think that's the end goal, right? Of like these types of project is that we start with our own communities. We start this dialogue, and then we see how we can um, use that same, not that same formula, but adapt the formula to have these conversation with others, communities, and then breaking those silos so that people, because I think, when people understand the history, uh, then they can start relating to other groups who have experienced similar histories, and that creates that solidarity. But before that, and that's something that that someone asked a question about. There's also the topic of resistance to these conversations. And so we have a question here um, from Brendan, who says that they have a question about dialogue with community members. In Edmonton's Chinatown, there is a barrier of apathy and not wanting to talk about drug use, policy, or humanizing members of communities. They're wondering if any of you have had and would be open to share experiences of breaking through that initial point of dialogue and sparking interest in the topic. So we're really looking at like what's that breakthrough before we're getting into that history, before we're getting into this inter uh communal solidarity. What's that first breakthrough that you felt was pertinent?
I think I don't know, hard to say because I feel like a lot of the seniors or clients we work with, they'll just share openly with us. Like usually their complaints or concerns with like open drug use that they see. And so that's usually an easy starting point for us to um, like validate them and also offer counterpoints or other, I guess, like um, yeah, food for thought. Um, yeah, and and then I think I'm more of an outspoken person, so sometimes I just ask people, or I do like to get in fights at the dinner table about drug use and policy. Um, but I think sometimes just having things visible, like having posters around, or wearing merch from different drug user groups. Um, yeah, it sounds kind of corny, but sometimes those EDI classroom posters do work, and it is a point for conversation because people will be curious about it. People will, whether they agree with you or not. Um, yeah, I think it's just good conversation starter, and it kind of sets the tone in a more subtle way where you don't have to directly bring it up in conversation. So yeah, I think it'd be great if there were more um, posters, graphics, things in different languages that are easy to print or share. Um, yeah, I don't know if that's helpful. I don't know much about Edmonton, unfortunately.
Yeah, I mean, from what I'm getting, it's pretty clear, like visibility, letting people know these conversations are happening with posters, having someone like you that's that's gonna shake the room and that's gonna, start those difficult conversation head on. And then yeah, being able to be visible so that the people who have all of this on their mind and want a space to talk about it, to have that space. So to me, those three steps together, I think is a very very clear and efficient way of answering that question. Thank you. Um, Anything else, Nicole or Liana, on this point?
I'll just say, and this is kind of an evergreen statement, it's applicable here and many other settings. Tapping into people's grievances with the government is often effective. So, you know, folks were really expressive and eager to share some of that. I often find, again, in many settings, that anger I feel could possibly be misplaced. People are taught to punch down, for lack of a better term. But if you can tap into that anger and that righteous anger and direct it to its source, that is very generative, and it was in this project as well.
I guess just to echo Nicole's point, while I was not able to attend the in-person sessions, hearing Bev and Nicole's feedback, by being able to draw on common similarities, and using very simple terms such as ingredients, a very common concept, I think participants were really able to, maybe that's when it started to click for them and to form solidarity and understanding of what our message is about.
Awesome. Thank you, everyone. I'll just answer one of the questions just really briefly. It's a question about if the report includes any methodology process on addressing the different views on drug use. And I will say the report is very thorough, especially with the methodology and the processes that was used for these dialogues specifically. But obviously, it's important to read the report knowing that it was done in conversation with a very specific community, and so some of the methodology might not apply necessarily to different contexts. But there's definitely a lot in the report, and it is very detailed. Sorry, Nicole, for answering this for you. It's just because our last question, I think, is a great question to end the webinar, and also I think it can be pretty complex. So let me just read it. So our last question is. Many Chinatowns across the country are places where people who use drugs congregate or congregate nearby, and these places are being destroyed by development and gentrification. Were there links to this in discussions and the erasure of Chinatowns? I can imagine these are points of solidarity. And also in the future, would you do this research with Chinese drug user sellers? Because there often feels like an erasure of Chinese speaking people as drug users slash sellers. So on this great question, I'll leave you all your space to answer the question and maybe share some final thoughts. And I'll put it in the chat so that you have it in front of you.
Oh, okay. Thanks, Nicole. Um, I think this is a great question. I had to read it twice because I got confused the first time, but that's just me. Um, yeah, I think this is something we tried to focus on and tried to emphasize that um, Chinatown and the downtown east side and people who use drugs are not all separate identities or communities, and we all live in the same community. A lot of us have overlapping identities. Um, and yeah, I've had conversations in passing with folks at Vandu, especially their like Chinese speaking or Chinese staff, um, about how yeah, there are a lot of people who use drugs who are Chinese and who are erased, like and who are marginalized at many levels, like in their families, in their communities, and at a systemic level, like with government. I think a lot of this is due to the model minority myth that a lot of Chinese or East Asian people have to reckon with. Um, yeah, and those stereotypes of like high achieving East Asians or immigrants. Um, yeah, so we did try to sort of unite around our disdain for the government and their inaction around not just drug policy, but again, housing, public amenities, yeah, transport, things like that. And yeah, I think it'd be great to have have research to involve like people who use drugs or people who deal drugs with Chinese heritage, or other like East Asian, Southeast Asian background. Um, yeah, but I think it's no coincidence that a lot of Chinatowns, um, not just Vancouver, um, yeah, have been communities that were made out of redlining and had drug use, crime, and just this undercurrent of um, yeah, I think a lot of the yellow peril narratives and fear of the neighborhood or the stigmatization of um, yeah, Chinese people bringing in opium dens. I know it's kind of weird now that opium was brought to China, and then now Chinese people are blamed for for drug use, or harboring and encouraging drug use, and other things that are seen as, I guess, societal ills like sex work, and poverty. So yeah, I think again, it's no coincidence that our neighborhood is like the convergence of all that, and a place that has a long history of systemic displacement, but also community resistance and the forefront of harm reduction and safe supply, as we've seen from like Dolph, Vandu, um, yeah, and folks who had to fight the Harper administration and all the ones following, actually.
I don't have much to add to that. I think Bev said it pretty perfectly. Um, yeah, yeah. And I'll just again emphasize the importance of having Bev lead a lot of that. It would not be appropriate for me to say some of what Bev did in that context based on some of your shared identities. And so having Bev lead aspects of that discussion, as well as like very generously disclose some of your own lived experience around stuff, was super helpful. Yeah.
Anything else on that point, Liana?
No, nothing for me. I think Bev said it very well.
Yes. Agreed. So we're at the end. There's some really interesting conversations happening in the chat. Someone is mentioning, that this whole narrative about, fleeing the scene of the opium den in Chinatown and not wanting to go back to that period. And immediately my mind went to this like fear mongering around safe consumption sites and their closures. And so there's so many links, there's so many points. And so just on that, I'm really grateful that to Yarrow for making these dialogues happen, because just addressing this kind of misinformation can be the difference between a community supporting safe injection sites, safe consumption sites, or like, organizing against them. Um, and yeah, any last words from you, Bev, Liana, or Nicole?
Thank you, Bev. Thank you, Yarrow. Thank you, Leanna. Thank you, everyone who participated in the project. It's been really wonderful, and we hope there is more. There is more to come. We'll have a bit of there's the report. We'll have kind of a methodology guide, at least in draft form, that we want available. There's an executive summary that's been condensed to like 9 pages. that will be available, and we hope there is opportunity, yeah, to do more with this work in an official capacity. But even if there's not, I know there are so many of you here today and elsewhere kind of already having these conversations, and we hope we can just be, yeah, an additional resource for that. Yeah.
Awesome. We're at the end. So yeah, thank you everyone. Thank you to Yarrow, the people who are tuning in from Vandu. Shout outs to all of you for participating in these dialogue. And shout outs to all our four interpreters who are in the background, making sure that this event and the recording will be accessible. That's a lot of hard work. So now we will leave you, the interpreters, to take a break from this lengthy conversation. Um, and yeah, thanks everybody in the chat for sharing contacts with each other and staying connected. Have a great rest of your day. Bye bye.